Deep Plane Facelift is mobilization and refixation of deep tissues. In classical facelift techniques, most of the tension is over the skin, and this makes worse scars and shorter lasting effects. We advise this operation to the patients who are over 40 years of age, but sometimes we advise also to the patients who are younger than 40 but have bariatric surgery and has a lot of skin excess. Facial expression and natural movement of the face are main concern of deep plane facelift. They are usually very well preserved, and after the swelling dissolves, the mimics of the patients return to normal. Of course, this is a major operation and the results are not temporary. But we usually don't say patients you will be 10 years or 20 years younger. What we tell them is they will always look younger comparing with their own aging process and their age group. I perform extended deep plane technique, which means we extend deep plane technique to the neck. So I can say maybe most effective part of deep plane is neck region. It depends from the patient to the patient, but usually within 2-3 weeks, swelling, bruises and scars of the hemostatic neck disappear. When swelling, bruises and scars of the hemostatic neck disappear, the patients could return to work. So we could say 2-3 weeks after the operation. We advise patients to wear a special garment after the operations for 2-3 weeks, and also lymphatic drainage is very important to prevent skin irregularities and swellings. The patients should be very clear about their health status with their surgeon, and they should share their current medications, their previous operations, because sometimes surgeons need to stop some medications and they need some extra tests for a facelift operation. And if patients are smokers, we advise them to stop smoking at least 1 month before the operation. The most common side effects of the facelift operations are swellings, bruises, and wound instances. There are some other risks which are not very common but very important. Those are like skin necrosis, bleedings, temporary or permanent nerve damage. We have a lot of precautions to minimize these risks. So the patients should be very careful after they decide for a facelift operation. They should choose an experienced surgeon and a hospital with enough facilities. I would say scar healing and duration of the effects. Scar healing is much better because tension is not over the skin, and duration lasts longer because hanging deep tissues are mobilized and refixated. Results are seen immediately after the operation.